So please welcome the former Seattle Chief of Police and Director of the ONDCP, Gil Kerlikowske.
That's a mouthful, isn't it? ONDCP, Office of National Drug Control Policy. That's why they just call me the czar. So, I've been gone 7 months. I was actually quite hopeful that the singing would have improved, even though Jack did a great job. First of all, let me just give a vote of thanks and appreciation during the 9 years as police chief to all of the support and help that I received from Rotary. One, you were certainly kind enough to put myself and Fire Chief Gregory Dean as honorary members, community leaders, and we had this great chance to come as often as we could and visit and interact with you. Talking to so many of you, having this opportunity to share the stage on a variety of occasions was just truly wonderful. And on several occasions you hosted large groups of either Seattle police officers or Seattle firefighters, and I can tell you that that meant a great deal to them. The outpouring of community support, particularly when I was here a week and a half ago for the funeral of Officer Tim Benton, means a lot. Police departments can be pretty inward-looking, and they can close ranks when someone is killed or injured. And during my tenure, I had 2 officers that lost their lives in service to the community. But they truly opened up, and they truly knew how much you cared and how much you appreciated their service and their hard work. And as a police chief or a fire chief, it meant a great deal to me also to have your friendship and your outpourings of sympathy and concern. So first, that's my thanks to all of you and to this great Rotary Club. Well, now I have the opportunity to serve in a whole new capacity. And the average length of tenure of a police chief in most of the big cities is about 3 or 3.5 years. Kind of tells you something, doesn't it? But to be able to serve 9 years in this wonderful city with a great staff and a good police department, tremendous community support was a real blessing to me. It was a blessing to Anna also. But then this opportunity came along, and I was actually a little bit surprised by it. I've never engaged in the politics of running for office or endorsing, etc. So when they called and they were talking to me, I said, I'm kind of interested maybe if something's out there in the law enforcement field, maybe customs, maybe one of those kinds of jobs. And they said, yeah, that's right. Well, we hear you, but we're going to talk to you about this job. So I quickly learned that the Office of National Drug Control Policy has been around since 1988. And there are 2 Seattleites, quasi-Seattleites, that have been drug czars out of the 6 drug czars. General Barry McCaffrey, who lives here in Seattle, and myself. For those of you that know and have heard General McCaffrey, he has not been the least bit shy about giving me advice about what to do. I have met with all of the drug czars. There was some concern that President Obama did not include the drug czar position in his cabinet. Every president gets to choose who are the cabinet members and who aren't. And when I went and met with Bill Bennett, he said, Gil, he said, do you have the president's ear? And I said, I do. He said, do you have the vice president's ear? And I told him that I did. He said, really, that's all you need. He said, when I was drug czar, he said, it was not a cabinet position. And he said, I'd been Secretary of Education, so I had been in the cabinet. He said, you know what, it's not that exclusive a club. So it's not a cabinet position, but you do have the bully pulpit of the White House. You do have this great opportunity to travel and visit and look at how the nation, at least in your opinion, how the nation should be dealing with this complex problem of drugs. Right now, we're having a great deal of difficulty, of course, seeing drugs on the front pages or on the headlines, unless, of course, you're talking about Mexico. But they're there. when I met with the President in the Oval Office and I talked to him about this issue, it was very, very clear that he understood the complexity of the drug problem, but also how it is woven throughout everything that we talk about today. Healthcare, healthcare cost containment, healthcare cost reduction, treatment, drug treatment programs are a significant cost. You know, I don't think anybody will vote to change healthcare based on the face of addiction. But if you realize how much money can be saved, if you realize how much money can be contained as a result of something called screening, brief intervention, referral to treatment. That is an interesting, great acronym called SBIRT. But what it means is that physicians and healthcare professionals are taught to ask their patients about drugs and alcohol. So, and it was tested here in the state of Washington, tested at Harborview, and it's been replicated across the country. So that if you go in to see your doctor, who you usually trust and admire, or your healthcare professional, and you said, gee, you know, I have a mole and I want you to take a look at this mole. Or you know what, I broke my finger out working in the yard. The doctor can also ask you just a short series of questions about your alcohol use and your use of drugs. And based upon your answers in that patient confidentiality, that physician or that healthcare professional can make an estimate. So 450,000 people were put through this screening. Some questions, they're a bit intrusive. But it's an important issue. 450,000 people. Harborview was one of the test sites. Of those 450,000 people, 22% received the following. 77% of them were given a brief intervention, meaning that, you know what, this is something you may need to look at. 14% were given brief treatment. 6% were referred to treatment professionals. Well, what does this mean? It essentially means that if these things are caught early and looked at early, it is not only a savings to you and your family, it is also a savings to the insurance industry and a lot of other groups. So the Obama administration looks at addiction as a disease. It's a disease that has about the same number of people as type 2 diabetes. It is a disease that has an age of onset between the ages of 12 and 21. And in fact, if you don't become addicted to a substance by the time you're 21, your chances of becoming an addict ever are very, very minimal. So prevention programs are also important. The criminal justice position is very important to all of this also. Half of the people that walk into treatment walk in handcuffs. And somebody would say, well, gee, you know, if you knock on the door and you say, I need help, you know, you may be more willing to get help and you may be more successful in the outcome. Well, the research says that whether you walk in with handcuffs or whether you knock on the door and ask for help, that the outcomes are still very, very similar. So the criminal justice community has a big part to play in the treatment area. And I'm a bit ashamed to say that after 9 years as chief of police, I cannot name 5 treatment professionals. I knew something about drug prevention programs, I knew something about the needle exchanges, etc. But I really was not in tune with treatment. And now I have this mission, this directive that I placed on myself to get all of my colleagues involved. Now, if you don't know, I ended the war on drugs. If you read the Wall Street Journal the first week I was in office, that was pretty easy to do. I didn't declare victory. And, well, I didn't want to work myself out of a job. I've been there a few months. But I thought that that talking for over 40 years about a war on drugs just isn't a very smart way to deal with what is an incredibly complex public safety problem and an incredibly complex public health problem. And talking about it as a war limits your tools, tells you that you can only get a few things like force that are going to be used in a war. It also tells an awful lot of people that we're at war with them. And frankly, we are not at war with them. I just attended this morning at 10:30 the graduation of about 15 people from the King County Drug Court. The drug court here is the 12th oldest in the nation. It has graduated several thousand people. And when you go and attend that and listen to their stories, and you see the fact that after treatment they are back with their families, they're back as good neighbors, they're back working, they're back paying taxes, and treatment is about 1/2 the cost of incarceration. And there is not a governor that I have met with, there is not a state budget that is not under assault when it comes to being able to reduce jail beds. So you can use effective treatment with sanctions. And everyone that testified at that drug court graduation talked about Judge St. Clair and the sanctions that he would render. And before that, it was Judge Laura Inveen. So you can't just come in and think that you're going to coast through the drug court system for a couple years. You are going to have to give a urinalysis every time you come in. And if there's a problem with that sample, you are going to leave that office, but you'll leave in handcuffs. So there are sanctions. It isn't, as one judge said, a hug-a-thug kind of program. It makes sense. Prevention, quality prevention programs also make a lot of sense. For those people that don't do that the prevention methods were lost on, of course, treatment can be effective and it works, whether it's methamphetamine or anything else. For the prevention programs, effective parenting, effective media messages. We fund the National Media Anti-Drug Youth Media Campaign. We fund about 750 drug-free communities. There are several here in Seattle for very small amounts of money. And those drug-free communities are community grassroots coalitions. They have boards of community members on them, and they work at trying to strengthen relationships with parents, with neighbors, with faith-based groups, and with schools so that quality evidence-based prevention programs can be put into place. Every year the President releases the National Drug Control Strategy. I know many of you have read it cover to cover, and I know you'll be waiting for it in February. If it doesn't come in your mailbox, I know you'll be calling me. But the National Drug Control Strategy has not actually been much of a strategy. It has been kind of more of an annual report. The President gave me some very specific direction, and he said that I would like you to go out and listen to as many people as possible so that you could learn a lot about this problem, and then you put this strategy together. I'll call the right people together, and then you tell us where we should be going. Wow, what an awesome responsibility. I was so excited. And then when I walked out of the Oval Office, I think my knees were starting to shake, and I said, yeah, it's a huge amount of responsibility to put this together. But I have received so much advice and input from people, not just drug court judges or police chiefs or sheriffs who are my colleagues, but people in treatment, people that are in drug court clients, people who run prevention programs, people who are involved in all kinds of aspects of the complexity of drugs. And the most interesting thing about this right now has been that I have never met anyone who has not been personally affected by drugs. Whether it's a friend, a neighbor, a colleague, a relative, it has affected everyone. We don't talk about it as much. In fact, alcohol is something that people will come up and say, you know, I'm an alcoholic, I'm in recovery, I've been in recovery, et cetera, et cetera. They don't talk as much about the drug issue, and yet there are literally tens and tens and tens of thousands of people that are in recovery that you would never guess. A police chief had introduced me to a large group, and I spoke, and afterwards he gave me a cell number, and he said, I've been in recovery 26 years. And he said, I just want you to know that. And the head of a large police union, a national police union, mentioned that he'd been in recovery for about a dozen years. So lots of success stories out there. I had this opportunity to walk across the Brooklyn Bridge on Recovery Day in in August, with over 10,000 people who were in various stages of recovery. Some had been in recovery 40 years, some had been in recovery 40 days. So with the right emphasis I'm very hopeful that I can get my colleagues, police chiefs and sheriffs, who have been very successful across the country in reducing crime by working in partnership with community groups. I'm very hopeful that I can get them to do the same types of partnerships with treatment programs and with prevention programs so that we can make a huge difference on the drug problem. How big is the drug problem? It's enormous in this country. How bad is it in Washington State? Your numbers are higher in Washington State for the marijuana abuse, cocaine abuse, opiate addiction. Your numbers are higher in this state than the national average. There are a lot of good people working on it. They're doing their best, but it takes a lot of additional effort. And again, it's some effort that can be done at less cost than the jail system, at less cost than incarceration. Prescription drugs are now killing more people, or drug overdoses are now killing more people in this country than gunshot wounds. I was actually quite surprised to learn that, and I thought as a police chief that would be something I'd want to know about. I didn't realize that, and I've been talking a lot about it. 16 states just reported that more people die from drug overdoses than die from car crashes. So I would be willing to tell you that on my next paycheck, I would bet you that more people in the country are dying from drugs than are dying from car crashes. There's almost no doubt in my mind. So drugs could end up being, and I believe they are, the #1 cause of accidental death in this nation. And yet I cannot get a headline about that. I can't get 5 minutes on the evening news about that. But by gosh, if you're texting and driving, you'll be on the NewsHour, you will be on the Wall Street Journal, you will be on the front page of the New York Times. I actually think that that's not the message that you shouldn't operate your computer while you are driving your car. Pretty simple to me. I didn't find that a really complex issue to deal with. Drugs. The first time the federal government ever tested to see who's got drugs in their system and they are behind the wheel was in 2007. The report was never released till about about 2 months ago. I heard about the report. I asked the Department of Transportation to come over and tell me about it, and they did. And the drug issue is complex. It is difficult. Alcohol is a very clear and simple message about .08 and DUI. For 40 years, we've tested about alcohol-impaired driving, and for 40 years, we have seen the numbers decline dramatically, well over 8% to around 2% in that 40 years, because of education and because of enforcement. So in 2007, they said, let's test for drugs. So when you're driving Friday evening, or you're driving on a Saturday evening, about 16% of the drivers, is that, for the economists, that's about what, 1 in 6 cars? About 16% of the drivers will be under the influence of a drug, a legal drug or an illegal drug. And all you have to read about, of course, is an accident like the Taconic Parkway in New York State, that horrific accident with children and a mother and truly innocent people killed as a result of an individual on both alcohol and marijuana. So drug driving is significant. People dying of drugs is quite significant. And yet for so long we've talked about it in the same way, about a war on drugs. We've talked about reducing the supply. The last thing that I'll mention before I turn it over to you for questions would be the international aspects. I've been on the southwest border 3 times in the 7 months I've been there, and I'll be back next month. I've been to Mexico twice. I've been to Bogota, and in January I'll be going to Afghanistan, Pakistan, and Russia. The issues that we're talking about on drugs are really significant. President Uribe said we have a growing addict population. The ambassador to the United States from Mexico said, Gil, don't think of Mexico as just a transit nation for drugs. We are a consumer nation. And in fact, Mexico just opened up their first drug court with our assistance in September. The Russian drug czar, there is a real drug czar in Russia. The Russian drug czar, Viktor Ivanov, is talking about 2 million addicts in Russia, and even President Medvedev has publicly mentioned that. The UK, Eastern Europe, West Africa, etc., the drug addiction issues, because drug dealers don't really care who they infect. They don't. It's nice that they could infect somebody in the United States that perhaps has more money, but you know what? It can be an impoverished village, and they're happy to addict those people too, because they know in some way, shape, or form those people will end up paying for those supplies of drugs. So we're all in this boat together. We can't point a finger at Mexico and say, gee, just stop the drugs coming across our border, because we have a lot of drugs coming right out of our own medicine cabinets. We can't just say, they can't point a finger at us and say, gee, if you could just reduce the demand because you have such a high consumption of drugs. We're all in this together, and we need to figure out smart and effective ways to deal with it globally, to deal with keeping our communities safe, and to deal with it in a way that makes fiscal sense. So with that, thank you very much. I'm happy to answer questions.
It's been a couple of years since they pulled Sudafed, et cetera, off the shelves in the drugstores. You have to go to the pharmacist with a little card to get the cold medicine. I'm curious to know if that's had any impact on methamphetamine production.
It did work. It was very helpful keeping those kinds of pseudoephedrine products where you actually had to show an ID and write in the log. Unfortunately, it doesn't work now. The reason it doesn't work now is because there are lots of people called smurfers, and they go out smurfing. And the smurfers have multiple identifications, and they go from store to store to store. I talked to a Los Angeles police lieutenant. They followed a 14 or a 12-passenger van with people with 10 and 12 licenses or forms of ID, and they would go from store to store to store to store buying. If you want to look at what looks to be some success in this area, you should look to Oregon. Oregon has made pseudoephedrine a prescription only. They have had it for 4 years. The numbers of methamphetamine problems, both laboratories and people being arrested, are down dramatically.
Gil, welcome back, and thank you for your service in this new capacity. You talked about the role of prescription drugs, and you talked about the issue of supply versus demand. What's the role of the pharmaceutical industry in trying to help correct this overall problem culturally, with the proliferation of advertisements constantly bombarding you about take this purple pill, do this, do that, just like the alcohol companies who now try and message drinking responsibly? What's your view on the role of the pharmaceutical companies and their proliferation in this?
Well, I think they need to step up to the plate at a far greater level, the pharmaceutical industries. There are only 2 countries in the world that advertise drugs, New Zealand and the United States. I did a piece on the morning show about Michael Jackson a few months ago. As soon as I got off the air, the first advertisement was for Ambien. I thought, you know, some director's probably going to get themselves into trouble. The juxtaposition of that was not particularly good. I think there's a strong message when every magazine and every newspaper and every television commercial said there is a pill to make your life better than it ever has been. And I think that the pharmaceutical industry needs to actually be aware of that.
Yes, I'm still trying to make up my mind on this issue, but obviously the laws regarding marijuana haven't been very good at controlling distribution, and law enforcement seems to be very frustrated in dealing with this. What's your position on that?
You know, we could spend a long time talking about marijuana legalization issues, medical marijuana issues, and you get overwhelmed with the discussion. So just a couple points about the medical marijuana. They looked at 4,000 people, and it's not a doctor's prescription, it's only a recommendation, but they looked at about 4,000 people who have those cards in California. The average age was about 32. It was a person who did not show symptoms of HIV, of chemotherapy because of cancer, because there are parts of marijuana that actually have medical efficacy. There is a lot more research to be done. Usually in this country, we have a process through the FDA to look at drugs. We don't get to vote on drugs. So I'd say on the medical marijuana, you have the one issue. The other, a lot of people talk about legalization and whether or not it'll save California's budget. The economists have great questions about that, and there's some examples, for instance, of Canada taxing highly cigarettes only to be unable to stop the smuggling, the black market that occurred within the United States. I would tell you that there's far more heat than light on this discussion, that there's a lot more rhetoric, and that if you look at what right now is a legally regulated, controlled, highly taxed industry, opioids, painkillers, we can't keep them out of the hands of people who are abusing them. We can't keep them out of the hands of kids. And these are already legal, controlled, highly taxed drugs.
Thank you very much for your service, Chief. As you were talking about this, I liked two parts of your comments. One was to attack the end user rather than worrying about boundaries and borders as an approach in this so-called drug war that we've had in the past. So I like the idea of the end user and analyzing that side. I also have appreciated your communitarian approach. So the question is, since the most addictive drug in our culture is a drug called nicotine, how are you proposing to work with others who might aim to limit its use as the #1 cause of morbidity or mortality in the United States?
Yeah, I mean, you've got your point is excellent. Alcohol and nicotine, although they are not in my lane, I'm kind of overwhelmed with the drug issues. On the other hand, talking about those, the CDC just released their report showing for the first time in I don't know how many years an actual uptick in nicotine use. That should be a concern for everyone. Underage drinking is something that I do mention and do talk about, and that's a concern also. I wish I had an answer for that. I don't.
Hi. I do have a question for you. And I'm so glad to hear that you're going with, beyond the borders to work with other countries. In the countries that I've been in, East Africa and Mexico, just like yourself, I've noticed glue sniffing to be one of the issues there. Well, glue sniffing is also an issue here, also on the reservations and what have you. And it's starting up again in the lower grades. When you said 12 for the other drugs, you're looking at below 12. Mm-hmm. And so my question to you, what's going on regarding that? And have there been statistics that show that there's an increase in glue sniffing here? And a lot of people don't realize that that's just as dangerous as the prescription drugs that the children get. Yeah,
we have a huge concern about the fact that we have made progress in many fronts on drugs. One of the most significant indicators of how well you're doing is whether or not in survey instruments young people perceive risk and harm as a result of alcohol, nicotine, and drugs. Those perceived risks of harm are softening. Usually that is an indication that is not good for us as a country, as a nation, among young people. So we did a very good job. We can't take our eye off the ball. We can't spike the ball at the 10-yard line and say, gee, we have made progress in a lot of fronts. And I think that it comes back to parents, comes back to neighborhoods, it comes back to faith-based community issues. We're not going to arrest our way out of the problem. I never heard my colleagues as chiefs and sheriffs talk about a war on drugs. I heard elected officials talk about a war on drugs. People, I actually truly believe, and if it doesn't turn out to be right, I'll be back here doing something else in Seattle. I actually truly believe that this nation is ready for a much more specific discussion about the complexity of this problem, that minimum mandatories and quick fix answers and war on drugs, and if we just get one more cartel, make one more seizure, do one more drug eradication, that we are going to improve on this problem. Not that we'll ever solve it, but I actually think the American public is ready for a better discussion, a more broad discussion, a more in-depth discussion about this. So we'll see. Thank you, Tim. Thank you.
Director Kerlikowske, thank you so much for being with us today, and thank you for your lifetime of public service. You are a ray of hope in the difficult battle of drug abuse, and we send all of our best wishes along with you for much success. Thanks again to all of today's program participants. Next week, November 25th, is a Rotary Day off. That's right, no meeting, no attendance, no makeup, no nothing. All you got to do next Wednesday is just rest up for the big eat coming the next day. This means that we'll see you 2 weeks from today, Wednesday, December 2nd, right back here at the Convention Center. The first thing we'll do is elect next year's slate of officers, board members, and trustees, so please bring your completed ballots. After that, we'll hear from Hansen Hussein, president of HRH Media, and director of the Master of Communication and Digital Media program at the University of Washington. And I will be making up for a mistake I made today. I forgot about half of the birthdays, so you'll get yours then. Something you can be thankful for is that I'm going to give my jokes one more week off. So instead, I'm going to read you a poem by author Joanna Fuchs called Thanksgiving Friends. Thanksgiving is a time for reviewing what we treasure, the people we hold dear who give us much pleasure. Without you as my friend, life would be a bore. Having you in my life is what I'm thankful for. We hope you have a wonderful Thanksgiving with your family and friends. See you in 2 weeks. We're adjourned.
Seattle Rotary Online is made possible in part by a grant from First Choice Health, working with the Washington Health Information Collaborative to use technology to bring better health care to patients throughout the Pacific Northwest. First Choice Health.